Hey everyone, it's Shannon with Sparkle and Shine Health and Fitness, and I am excited to jump on tonight and share with you the third in my Germ Buster series. Today was a beautiful day out. I hope everybody got outside and enjoyed it. It was the first track meet of the season today, so I enjoyed part of the afternoon outside, and it was great to see all the kids competing in track. It was a fun event today, and so I got a little sun, a little wind, and then it got really cold towards the end, and it looks like it might rain, but we'll see. But anyways, tonight is the third series in my Germ Buster series, and tonight I'm going to talk about food poisoning. And food poisoning is commonly referred to foodborne illnesses, but more specifically food poisoning. And fun fact, 1 in 6 people will get sick with food poisoning every year. 1 in 6 people, so there's a good chance you can get it. So it's good to know exactly what symptoms you'll have and how to treat it, how to get through food poisoning on your own, maybe without having to go to the doctor. So that's what we're going to talk about today, is food poisoning. Food poisoning can be caused by both bacteria, viruses, or parasites, and there's a lot of different ones that can contaminate food. So first of all, we're going to talk about the signs and symptoms of food poisoning. Signs and symptoms that you will experience with food poisoning are nausea, vomiting, watery diarrhea. Usually you have really bad abdominal pain and cramping, which kind of contributes to the vomiting and the diarrhea. And sometimes you can run a fever, but you don't always have to run a fever with food poisoning. Food poisoning can start as soon as a few hours after eating that contaminated food, or it can be like several days or 5 or 6 days later. So there's a wide range in there when you can start getting sick with food poisoning, depending on which contaminant is on your food that's causing the food poisoning, like which bacteria or which virus. And we're going to talk a little bit more about that. And so what are the causes of food poisoning exactly? So food poisoning happens when you have contaminated food, and it can happen in the processing of food, the harvesting of food. I know last year or a couple years ago, we had a big outbreak of Listeria from cantaloupe that was grown in Colorado, and that was actually from the harvesting of the cantaloupe and the touching of it. So that happened way out in the field before it ever got to us, but then we got that contaminated cantaloupe with the Listeria on it. You can have salmonella on like chicken, which is why everybody tells you it's really important when you have raw chicken on the counter to make sure and disinfect that area really good before you put any like raw vegetables on that counter that you're going to eat. Because when you go and you cook the chicken, it kills the salmonella that may be on it, right? But then if you put fresh vegetables on the counter and turn around and eat them, you haven't killed that salmonella because it's fresh. And so that's how you can get sick. So that's why it's important to disinfect between the cooking and the cleaning of the surfaces. The shipping, the processing, there's so many outbreaks that you see come through. So it can be before we even get the food, or it can be after we get it, we get the cross-contamination going on. So I want to share with you a couple things. I have a list. If you go to my blog when I'm done, I have a chart that I'm going to list for you. And I list out some of the common bacteria and viruses that cause food poisoning. And I'm going to share a couple of those with you, ones that I know you will know about, like salmonella, for instance. So if I read on here, salmonella, the onset of symptoms is 1 to 3 days. And it comes from raw and contaminated meat, poultry, milk, egg yolks. And it survives inadequate cooking. So if you don't cook it well enough, it doesn't kill it. Okay. Another one on my list is E. coli. That's a very common one. The symptoms begin 1 to 8 days after contact with the contaminated surface. And the common ones of this are beef, undercooked beef, unpasteurized milk, apple cider, alfalfa sprouts. I don't eat those very often. Or contaminated water. So those are the sources of E. coli, and I'm sure you guys have heard of that one. The other one that I mentioned is Listeria, and we've had some Listeria outbreaks in the area off and on. 9 to 48 hours after you eat that one is when you begin to get sick. And the common sources of these of Listeria is hot dogs, lunch meat, unpasteurized milk, cheeses, raw produce, and it can also be spread through contaminated soil and water. So for instance, the one that I was talking about was the cantaloupe, and that was Listeria. The one thing that I do tell all my OB patients, with Listeria, stay away from it. You know, I could take that cantaloupe and wash it off and take the chance of eating it and not getting Listeria. If I get it, I would get sick, yes, but I'd probably get over it because I'm a fairly healthy person. And in an OB patient, a pregnant mama, it is really important just to completely avoid it, because if that pregnant mom gets Listeria, it can be fatal to the baby, okay? So don't even take the chance if you're pregnant, if there's a Listeria outbreak. And first thing, when I hear those outbreaks that are going around, the first thing I do is notify all my OB patients, because it is very vital to stay away from Listeria outbreaks. The most recent one, just 6 months ago maybe, was hummus. There was an outbreak with the hummus, and so stay away from that, right? One more I wanted to share with you that maybe you've seen in the news recently is Campylobacter. And the onset of that is 2 to 5 days, and it is usually caused from meat and poultry. The processing, the meat surfaces, unpasteurized milk, and contaminated water. So those are just a couple that I wanted to share with you from my list, but read my blog post afterwards, because I have a bunch of them listed out. It tells you the onset of symptoms and how they're contaminated, how you get those contaminated things, and great list. Read those lists. There's some really good ones on there, and I know there's some other ones that you guys have heard of too that are really common in food poisoning. So the last thing, what is the treatment for food poisoning? Basically, it's one of those things where you're treating the symptoms. You can get dehydrated really fast with food poisoning because you're having vomiting, diarrhea, right? And so it's really important to stay hydrated. Push the fluids, the water, the Gatorades, the diluted Gatorades, anything that's not caffeinated. Start with the fluids really slow and increase them. And then there is one other thing. Sometimes certain types of food poisoning need antibiotics. It completely depends which of those bacteria or viruses, mainly the bacteria that are on that blog post that I wrote. Depends which one it is, they may need an antibiotic to kill it, depending which one it is. So those are just a couple tips about food poisoning. Unfortunately, since 1 in 6 people get it, there's a good chance that we will get it. So it's great to be informed and know exactly what to watch for, how to treat it. Everything that I share with you is based from the CDC, the Centers for Disease Control, and from like Mayo Clinic and Shea and all those APIC, the big sources that we use in the hospital to go off of. These are not me making them up or just sharing my opinion, and I just want to share that with you. Little disclaimer there. But everyone, thank you for jumping on and listening to my little educational series tonight on food poisoning. Have a great night.